Told you the stories of COVID-19 survivors and their message about the disease, and the stories of nurses and doctors working around the clock to save lives. Tonight, WMAR 2 News' Abby Isaacs introduces us to someone who has been on both sides of the fight.
From provider to patient and then back into the hospital, Johns Hopkins Dr. Sapna Kudchadkar has a unique perspective about the impact of COVID-19.
The last 2 months have gone by in a blur.
In her 17 years at Johns Hopkins, none of them have been like 2020.
I started out as a physician.
But by late March, pediatric ICU and anesthesia physician Sapna Kudchadkar was a patient. She tested positive for COVID-19 and had to quarantine in one room in her Howard County home for 2 weeks.
And my family would bring food and leave it on a tray outside my room. So it was 14 days of complete isolation, just contact via Zoom and FaceTime.
Her symptoms were more mild, but the feeling of isolation was overwhelming.
By day 10, I was in a very dark place.
She's grateful to have made a full recovery. Celebrating the end of her quarantine with family. And then it was back to Johns Hopkins. Because of the need, she transitioned to the adult ICU, working with patients severely ill from the virus she just battled.
What really kind of hit me that I didn't expect is this sense of, why me? Why was I so lucky? And why did I have such mild disease and was able to come out and, just get back to my normal life while these patients clearly have been severely impacted by the disease.
Now she's driven to help as much as she can, working with patients while researching the long-term impacts of the virus. And she became a research subject herself.
I actually have enrolled in several research studies and just donated convalescent plasma, since that's a potential therapy for patients who weren't as lucky as me, who are very critically ill.
As someone now involved from all sides, she hopes people continue taking the virus and prevention seriously.
The impact on public health is so severe that, what people are doing, social distancing, staying at home, those are the most important things we can continue to do.
She said even with hospitalization numbers trending downward across the state, medical providers are preparing for this to continue for a long time. For WMAR 2 News, I'm Abby Isaacs.